Unpacking iliotibial band pain coming up next. Hey FreeBody family, Kat Matlock here in Asheville, North Carolina at the FreeBody Clinic. Our motto is get out of pain, take your life back. Get out of pain, take your life back. Iliotibial band pain is a nuisance, it's challenging, it messes with your running, it messes with your ability to sleep, that ache or that pain. What is causing it and how do we get rid of it? That's what I want to share with you today. So first I want to explain that there are two kinds of iliotibial band pain that we're going to talk about in this video. The first one is iliotibial band pain syndrome, which happens just above the knee, most common in runners and soccer players and athletes who do a lot of running and kicking. That is one iliotibial band pain, and that tends to happen just around the knee, just above the outer knee. Number one. Second iliotibial band pain that we're going to talk about is that deep ache in the iliotibial band. Maybe it starts up in the hip, maybe it aches down the iliotibial band, or just the whole center of the iliotibial band aches. Those are two different kinds of iliotibial band pain issues. They have different causes, and we're going to talk about both of those in this video. Okay. First, let's talk about the iliotibial band itself. I want you to understand that you can never stretch it. You can never release it. That would be like releasing a ligament. You never want to do that. The iliotibial band is a stabilizing structure. It is there. It is meant to be this tightly woven, strong fabric that creates stability from the pelvis through the hip and down to the knee. It stabilizes that whole outer chain, pelvis, hip, outer knee. You cannot stretch it. It shouldn't be stretched. If it gets loose, you're really in trouble. And it would take an extraordinary amount of force to actually release it. Don't do that. Stop trying. It's not helping. Okay. Now that we got that out of the way, it's a stabilizing structure. It can't be stretched. It can't be released. And it's not really often the cause of the pain. The only time it's really contributing to the pain, in my experience, is that first condition that runners, soccer players, iliotibial band pain syndrome, that's just above the knee. So we're going to talk about that first. Okay, why does this happen? Often what happens in this scenario is that runners or people who cross their legs a lot and get that pressure right there on that outer knee, what they're doing is shortening. The inner thighs are really short. Cyclists often get this kind of iliotibial band pain, sometimes the ache also, but the inner thighs are often the secret culprit. Something I say on this channel over and over again is the muscle that's crying out in pain or is loaded with trigger points is often the end of the tensional train and not the beginning. So you don't want to just rub on that spot. It never helps, so stop doing it. If you're doing it, stop doing it. It's not helping. It might just be aggravating it. And really what needs to be addressed is the inner thighs first, because what happens when we cross our legs or hug in to ride a horse or hug in to ride a bicycle or doing a lot of running and one hip is higher than the other, and then that side, the inner thighs get shorter and kind of pulling. When the adductors get short, pretend these are knees, the knees come in closer together, and when that happens, the femurs have to push out of the socket. These are knees, these are tops of femurs. They push out of the socket, and that can kind of pull and put a strain on that iliotibial band, and then getting close to its lower attachment at the knee, it can get a little aggravated. So just attending the iliotibial band, rolling around on the iliotibial band, isn't going to fix it in this scenario. You want to release the inner thighs first. And I'll put a link in the description of some ideas about how to do that. So that aggravation, that little inflammation, that little pain at the bottom of the iliotibial band on the outer knee, that true iliotibial band pain syndrome, really is helped. And I'll share with you a story. I was helping the RAD team at a yoga festival one day, and I was sitting in while they went to have some lunch. A woman came in with iliotibial band pain. I was like, well, hop on this roller here, release your inner thigh first. And then I said, don't do anything on the outer thigh or the iliotibial band yet. She released her outer thighs, got up completely pain-free. She didn't even have to release that. She just needed to shift what was pulling or pushing on that iliotibial band to free it from that pain syndrome. Inner thighs, super important. Now, second scenario, that ache along the outer thigh sometimes comes from the hip, sometimes aches all the way down. It's debilitating. It makes it hard to sleep. You can't lay on that side. You can't lay on the other side. It might ache when you're walking. It might ache when you're running. Even when you're just sitting, you cross your legs and you're like, it hurts after a while. Why is that? 3 muscles that cause iliotibial band pain, that it just feels like it's coming from that iliotibial band. Number 1 is a quadricep muscle called vastus lateralis. The vastus lateralis lives deep to underneath the iliotibial band, and the iliotibial band lays on top of it. So sometimes when you if you roll on a foam roller, or if you're working with a client and you're pressing, you got to be real careful, right? That's always so tender along that iliotibial band. I recommend releasing it yourself against a wall, not laying your weight on a foam roller, because that's just terrible and painful. So I'll link in the description video for rolling that vastus lateralis against the wall. When the quads are fraught with tension, often it starts in the hamstrings and the glutes. So you'll want to check, do some release in the hamstrings, do some release in glute max. Of course, I'm going to link videos in the description. Then roll that vastus lateralis along the outer thigh. That's how you're going to take care of that quad thing. And you also just want to check and make sure that you're doing movement throughout your day, non-weight bearing leg, knee stuff to kind of get those tissues sliding and keep them in a more friendly relationship. Now, the last 2 muscles that cause iliotibial band pain, that ache down the outer thigh, that could also ache in the hip, are tensor fascia lata and glute min. They're right next to each other on the outer hip. TFL, or tensor fascia lata, comes from the front point of the pelvis, called the ASIS, anterior superior iliac spine, for those of you that like anatomy words. And it kind of dives backward and anchors into the iliotibial band, that stabilizing structure. It pulls on that iliotibial band. It causes hip flexion. It contributes and supports hip flexion. But tensor fascia lata, what that even means is that the fascia lata is the iliotibial band that then becomes the wrapper around the whole thigh. And my belief about this muscle is that its job is to tense, to strengthen and tighten the fascia lata, that wrapper around the thigh, which then will give the quads more power. It gives the quads more power. So if you're working out your quads, you're running, you're kicking, you're doing all this stuff, that TFL is going to get really activated, and it might get loaded with trigger points, and then it aches down the iliotibial band. But if you don't understand that it's coming from there, you're just going to be trying to release that iliotibial band, which you can't do anyway, and then not get out of pain. So check the TFL. Also, the glute min, number 3 muscle that causes iliotibial band pain down the thigh, maybe even in the hip. Glute min is our sciatica imitator, so you could also be having sciatica type symptoms down the hamstring, aching in the calf. When the glute min causes iliotibial band pain, it can even ache down into the outer shin. If you've got that pattern, outer shin aching too, or maybe some hamstring aching too, or maybe a butt ache also, definitely gluteus minimus is a piece of the puzzle. So if you're working with a client who has iliotibial band pain and they have sciatica symptoms, you've got to also check inner thighs, and you also want to work in the outer hip of the opposite side. Same if you're working in your own body. Often the muscle that is crying out in pain, in this case the glute min, is going to be pulled by another muscle, the opposite muscle group, the TFL and glute min, on the other side of the body. So if you're having that pain down the right thigh, release the left one first, because often the pelvis is off kilter and the glute min and TFL are real short, chunked up on one side, and they're like, oh, on the other side, kind of like this, ah, and they get freaked out, and then they start to ache because they're constantly trying to pull the pelvis back to level. That's a lot. That's a lot of information, but hopefully it helps you, right? Because if you're just rolling your iliotibial band and it's not getting better, or maybe it seems to help a little bit, but then it comes back, it's because you're not treating the whole system. And I want you to understand what that system is. So key elements of treating iliotibial band pain syndrome, the first case where it's just above that outer knee, treat the inner thighs first. Relieve that tension in the inner thighs that might be pushing the femurs and kind of, pushing against the iliotibial band, causing that pain at the bottom. Then you could release some of the vastus lateralis outer thigh too, because that can cause pain right there at the same time. But good to check inner thighs first, then the iliotibial band. But even check and see, did that release of the inner thighs make that pain syndrome go away? Maybe so, right? It may not be magic the first time, but give it a few days of doing that and then see what happens. You'll probably find you're way less pain, if not completely out of pain. Second scenario is that it's coming from either that quadricep, right, where you want to release a little hamstrings, maybe glute max first, and then work along that outer thigh, along the quadricep, the vastus lateralis. You're not releasing the iliotibial band, you're working on the quadricep muscle beneath it. Final scenario of iliotibial band pain is TFL and glute min. TFL and glute min get freaked out when one hip is higher than the other. Often the higher hip is the one that is radiating down. So release the opposite side first. If that hip is not higher, it might be because you're kicking or you're always leading with that leg and have built up. Maybe you decided in your 40s, like, I can play soccer. I did it when I was 15. I'm going to go for it, right? Great idea, but you got to build up the fascia. You got to build up the strength in the tissues before you just jump right in there, right? And so that could be leading to some of this pain. So I trust that you found this video to be helpful. Check for the links below so that you can see how to treat these muscles, both the opposite muscles and the muscles that are causing this pain. We are on the pain referral playlist. This is Kat Matlock here at FreeBody. Thanks for watching. I'll see you in the next video.